some of the common symptoms of acid reflux are having a burning sensation in your chest, feeling either food contents or acid coming up into the chest or even in the back of the throat. Those symptoms are frequently worse at night when you're laying flat in bed. I've got some patients that complain that they have to sleep upright with extra pillows propping them up or even in a recliner to help alleviate the symptoms, whether it's actual food coming up or just that acid taste in their mouth. It could be either one of those. I've had some patients that have been actually referred by ENT doctors because they've had constant irritation of the throat from acid, which causes a chronic cough. And over time, it's hard for them to distinguish whether that's coming from the lungs or coming from the throat or coming from the stomach. And so by decreasing the acid production going up into the esophagus, that can actually decrease your symptoms in other areas of your body as well, like in your throat and in your lungs. So most patients that have been bothered by reflux have actually started treating themselves because there's a lot of over-the-counter medications available, from very mild drugs like Tums or Rolaids to more potent drugs like Pepcid or Zantac. And now there's actually some very good drugs on the market called proton pump inhibitors, such as omeprazole, Nexium, lansoprazole, Prevacid, Protonix, things like that. And you can get low doses of those drugs actually over the counter now. So most patients that come into their doctor complaining of reflux, they've already tried multiple things to try to make their symptoms better, including propping their head up on pillows at night when they sleep. So the next step would be seeing your primary care doctor, usually, where they may prescribe a stronger medication or a prescription dose of one of those medications. Frequently, the next step is referral to the gastroenterologist to really evaluate the stomach and the esophagus with an endoscopy to look to see if there's maybe a hypohernia present that could be making the symptoms more complicated, or maybe there's damage to the esophagus, like esophagitis, chronic inflammation, even Barrett's esophagus, which can over time lead to an increased risk of esophageal cancer. And so that's typically the next step. By the time I, as a surgeon, have seen the patient, frequently the patient's been on multiple medications. They've had endoscopies by a gastroenterologist, and either the medication isn't working and they're still having symptoms, or they've decided they just don't want to keep taking those medications, because if you've got really severe symptoms, you may have to be on those medications for the rest of your life. Even if they're working well, that's still an expensive medication that you take every day that may have significant side effects. We're learning more and more about possible long-term side effects of those drugs, or any drug really when you're on it long-term, but specifically to the proton pump inhibitors, we're seeing an increased risk of fractures related to bone loss. There's an increased risk of kidney disease, and there's even a concern of an increased risk of Alzheimer's dementia. And so some patients, even if they're getting good control of their symptoms with the medications, they may choose to take that next step to get off those medications to prevent some of the long-term problems.